Sexual desire comes from the brain.
Sunki.
Many of you ask if there are alternatives for Cialis. Well, the answer is yes. One of the alternatives is called Vardenafil. Disclaimer, this is not an advertisement. All of these medications should only be used strictly under doctor's supervision. Remember, do not self-prescribe at home. Hi, it's your pharmacist Sunki here. Please make sure you watch until the very end so you don't miss out on any important information. Now, let's talk about our main star for today, Vardenafil. Vardenafil, common brand name Levitra, is used to treat erectile dysfunction in men. It is a phosphodiesterase 5 inhibitor which relaxes blood vessels in the penis so blood can flow into the area for erection. Vardenafil will not work if you are not sexually aroused, and it will not increase the sexual desire. Sexual desire comes from the brain. Before taking Vardenafil, please tell your doctor if you are allergic to anything, if you have any other medical conditions, or are on any other medication. Because sexual activity may place a strain on your heart, your doctor will need to check whether you are fit enough to perform sexual activity. How to take Vardenafil? First of all, it is important to follow all the directions from your doctor and your pharmacist carefully because it may be different from the leaflet. It may change according to your condition and the type of other medications you are taking at the same time. But in general, swallow the tablet whole with water. Whole means whole, which means you're not to cut, break, crush, or chew it. It can be taken with or without food. Take it 25 to 60 minutes before the activity. Levitra may work as soon as 15 minutes and as long as 4 to 5 hours after taking it. The amount of time it takes to start working varies from person to person. The doses of Vardenafil ranges from 5 mg to 20 mg. Your doctor will determine the correct dose for you. Do not take more than 1 dose of Vardenafil in a day. If you are taking an alpha blocker other than tamsulosin or efluzilsin, which are medications for benign prostate hyperplasia, allow at least 6 hours between the time you take it and the time you take Vardenafil. Remember to avoid consuming grapefruit or grapefruit juice while on Vardenafil. Now, if you have not subscribed to my channel, please consider subscribing and turn on your notification button. This channel is dedicated to improve your health and well-being. Now back to Vardenafil. Do not take Vardenafil if you have or have within the previous 6 months a heart attack, a stroke, cardiac ischemia, or serious irregular heartbeat. Do not take Vardenafil if you have unstable angina where the symptoms is chest pain, low blood pressure, uncontrolled high blood pressure, uncontrolled irregular heartbeat, ever had a loss of vision due to damage to the optic nerve from insufficient blood supply, hereditary degenerative retinal disorders such as retinitis pigmentosa, severe liver problems, severe kidney problems requiring dialysis, been diagnosed with a disease called pulmonary arterial hypertension. Do not take Vardenafil if you are on any of the following medications. Number 1, nitrates. These medicines are usually used to treat angina, which is heart pain. These medicines include glyceryl trinitrate, also called nitroglycerin, nicorandil, sodium nitroprusside, isosorbide mononitrate, isosorbide dinitrate, amyl nitrate, also known as Popper's amyl or Rush, vice versa. If you get an angina attack while taking Levitra, do not take any nitrate medicines to relieve the pain. Your blood pressure might drop too low to a dangerous point that is difficult to treat. Send yourself to the nearest emergency department of the hospital and make sure that the doctor at the emergency knows that you are taking Vardenafil. Number 2, HIV protease inhibitors. Medicines used to treat HIV infection such as cobicistat, indinavir, or ritonavir. Riociguat used to treat pulmonary arterial hypertension. The above list of medication is not the entire list where Vardenafil should not be used. So make sure you tell your doctor all the medication that you are on. Vardenafil can interact with many other medications, such as ketoconazole and itraconazole, that is used to treat fungal infections. Erythromycin, clarithromycin, which are antibiotics commonly prescribed. Alpha blockers, which are used to treat enlarged prostate or high blood pressure, such as prazosin. Now for this list of medication, dosage of vardenafil or your medications might need to be adjusted. The way you take the medication might need to change, or your doctor might need to change the medication entirely. Side effects. All medicines, even natural herbal medicines, come with side effects. Some side effects are severe and need medical attention immediately, but most of these severe side effects are usually rare. Most side effects are mild and short-lived. When a doctor chooses to prescribe you a medicine, he or she would have weighed out the benefit exceeds the risk. Do not be alarmed by the list of possible side effects. You may not even experience any of them. Tell your doctor or pharmacist as soon as possible if you do not feel well while taking vardenafil. Some common side effects of vardenafil, which are usually mild and short-lived, are headache, dizziness or lightheadedness, flushing, a stuffy or runny nose, dyspepsia, heartburn, nausea. Rare but severe side effects are priapism, where your erection may persist for longer than usual. Use an ice pack to cool it down if this happens. If your erection continues for longer than 4 hours, or if you have a painful erection, go to the emergency of the hospital immediately. There are men who took vardenafil and report a sudden decrease or loss of vision, or sudden decrease in hearing or loss of hearing. These cases are rare. If this happens, stop vardenafil and go to the emergency immediately. Other conditions where you need to send yourself to the emergency or call an ambulance are if you have any tightness or pain in the chest, neck, back, or arms, as well as fatigue, lightheadedness, abnormal heartbeat, and anxiety. This may be a symptom of a heart attack. Loss of consciousness, or an anaphylactic allergic reaction where symptoms are rash, wheezing, swelling of face, lips, tongue, which may cause difficulty breathing and swallowing. Now, besides a pharmacist and running this channel, I am also a singer-songwriter and an actress. I run a second channel where I put my original music and entertainment videos. If you are interested, I will put the link down below for you. Now let me know what other videos you would like me to make, and please do share your thoughts in the comment section down below. It's your pharmacist Sunki here. See you around.
Vardenafil.
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 Vardenafil. Not Vardenafil. Vardenafil. Really? Is this American?